Good day, my dear postgraduate students. Welcome to the class on stem cells, rather adult stem cells. This is from the recent advances 21. Last exam, quite a good number of questions had come from these, and we had managed to cover them. And our journey shall continue. These are the authors who have contributed a lot in this. The prologue. Prologue is some kind of an introduction. All of us know about Dolly and the cloning of the sheep. So there is a nucleus donor over here and a cell donor. You find that the elements are being removed, extracted, and this particular cell is being emptied. There is a cellular fusion. Electrical pulses are being introduced, and finally there is a fertilization giving rise to the dolly from a surrogate mother. So this is something about Pearl's buck, the good girl. This again is just an idea about the stem cell harvesting. Stem cells are taken, for example, from the patient or from a donor, and they are in a mixture with other cells. The stem cells are being removed, and the antibodies play a role in their removal. They are clubbed together, and finally you find that there is a reduction in the volume. Cryopreservation of the stem cells is being done. There is a thawing, and finally there is a dilution, and it is being infused into the patient or the recipient. So this is just a story of it for us to have an idea about it. Way back in 1998, two papers had been published on the in vitro growth of embryonic human stem cells from the inner cell mass or the blastocyst. Later, murine embryonic stem cells were used. And finally, they realized that there is a versatility of the human cells, and the journey it continues. There was a lot of enthusiasm, and people started conducting researches, in which case we call it an overdrive. So this is just a movie. Scott Eastwood is the hero over there. Overdrive is a tendency wherein we tend to go beyond the limits. It can be beyond the limits of finance or ethics. Continuing with the introduction, there are some cells or some tissue where there is a continuous turnover. Epidermis is one, the skin, small intestine, bone marrow. The stem cells will be persisting infinitely in these areas, and their potency is greater than the transit amplifying cells. Niches are formed in other cells, and they will be secreting substances to keep them alive. There is some kind of a microenvironment around these cells which will be secreting substances to keep them alive. The liver has got a minimum number of cells when compared to these. So this is a picture of a stem cell by electron microscopy. You find that nothing can be made out of it. They are undifferentiated. Even today, there was a class on the leukemias, and one was an undifferentiated leukemia. These cells are found throughout the body after development and multiply by division. They replenish the dying cells. So that is the potency of them. They have got a tremendous ability to divide, and they can generate cells of all lineages. On the contrary, when you look at them under the light microscope, this is a mesenchymal stem cell, you find that there is hardly any difference between the normal cell and the stems. So this is more like a macrophage over here. The adult stem cells are undifferentiated cells that reside among differentiated cells in any organ. That is, they are undifferentiated, whereas the surrounding cells are well differentiated. They can be residing in any organ, as we had mentioned earlier. They have the ability to renew themselves and differentiate. While embryonal stem cells can become all cell types, you find that the adult stem cells have got limited modes of differentiation. They can be multipotent or unipotent. The primary role of the adult stem cell is to maintain and repair the tissue in which they reside. So if it is going to be in a liver, they will be repairing the hepatic parenchyma. Somatic stem cells, Dolly the sheep, we had seen the story of it. They contain DNA of the somatic cells. And as I had mentioned earlier, you find that it is being removed and transferred onto a non-fertilized egg. Finally, the inner mass is removed and an embryonic line is being created. Now, what will happen? Why can't we do the same thing in the human beings? Because there is an acute shortage of the human eggs. Secondly, how far it is ethical, we do not know. It is controversial. And also, as the lady grows older, you find that there is going to be a massive decrease in the amount of stem cells. They can be divided into the epithelial, bone marrow and hematopoietic, or neural. Epithelial, as I mentioned earlier, they can be in the epidermis or in the intestine. And bone marrow is another one. They can be transplanted into the neurons, muscles, and the epithelium. Here they are the precursors of the bone marrow cells, various hematopoietic cells. And sometimes we can harvest them and return back to the donor or the patient to prevent immunological reactions. The neural stem cells are present in the brain and they are formed only in the olfactory bulb or the hippocampus. And there is a story that even these could be grown in culture. And they give rise to what is called as the neurospheres. They can be used in certain diseases such as Parkinson or there is a degeneration. So look at this over here. There can be the neural stem cell that can be from the brain or it can be from the spinal cord. Or there can be the hematopoietic stem cell from the bone marrow. Also, you find that there can be the epithelial cells. These are the different types of cells that we should be having in mind. This incidentally is the neuronal cells that have been grown in culture. And unfortunately, when reinfused into the patient, they are unable to grow to that extent. This picture incidentally is from ResearchGate. Nowadays, the stem cell research has come of age. And it is very important because of the increasing amount of morbidity, mortality, and malfunctions of the various organs. So this has given rise to what is called as stem cell research. This incidentally is a major breakthrough, so much so that it has become a daily news. But there has been a lot of legislation for and against it. Research has been conducted. A lot of government funds is being spent for this from the taxpayers' money. Basically, as I told you, there can be the embryonic stem cells and the adult stem cells. What are the basic differences between these? We shall be seeing. Source. It is from the embryo, it is from any adult tissue. Potency. It is pluripotent. It can diversify to any limit. Whereas here, there is limited differentiation. Cell culture is easy, whereas here it is challenging. Chances of rejection, we do not know yet because this is not permissible and it has not been completely practiced. Moreover, it cannot give rise to the placenta and the fetus on it. Whereas the chances of rejection are less likely in the adult stem cell. The obstacle for use can be the ethical controversy. Here in this case, a concern from the patient. I would like you people to kindly by heart this particular table. A simple one. Develop the concept by heart whatever is possible. And adult stem cells. Now there is a stem cell cover-up. They say that we are doing this for so many reasons. And there is an attempt to downplay also the adult stem cells. Probably they do not want it to develop further. And this we call as stem cell wars. At one end, people want to do it. At another end, they want to prevent it. Called as stem cell wars. So a hierarchy of potential comes into play. Look at the various regions that can give rise to the adult stem cells. In the human body itself, the dental pulp, it is something like a hair follicle over here. So these have got some cells with immense potential. Synovium, nobody imagined. Nervous tissue, but it can be only in vitro. Adipocytes, cartilage, gastrointestinal tract, particularly the small intestine, pancreas, particularly thought of in cases of diabetes, skeletal muscle. It can be differentiating into the cardiac muscle also, and the skin. Of course, we have got the bone marrow over here. So these are the sites for the adult stem cells. Embryonal stem cells, as I told you, pluripotential, differentiate in all the three germ layers. It cannot give rise to the placenta or the supporting tissue. Whereas the adult cells, these are the things. We have seen them already. But this is important. The small intestine can produce 4 lineages. There are the Paneth cells, goblet, columnar, and enteroendocrine. The CNS has got the neurons, oligodendrocytes, and astrocytes. Heart, there is an endothelium or endocardium, cardiomyocytes, and smooth muscle. Self-maintenance. So you find that the embryonal cell or the stem cell is relatively undifferentiated, whether it is adult or embryonal. They do not have any functional specialization. This is important. They have got a tremendous ability to renew. Kindly by heart this particular one. In the small intestine, they occur at the base of the crypt. In the heart, in the least hemodynamic area or area of stress. Germ cell, stem cell is maintained also. And there are certain things, drugs which can be affecting them. Armadillo, B-catenin, and decapentaplegic. And APC can give rise to the adenomatous polyposis coli. The stem cell division is the replacement of one stem cell plus another transit. I'll be showing you a flow diagram of this. There is an asymmetrical cell division. This will be difficult to understand. I shall explain it again when we go to the diagram. So this is one that we will have to remember. There is something called as proliferation, clonogenicity, and genomic integrity. We must understand that the stem cells are slow cycling. They are very slow in multiplying also, but then highly clonogenic, in which they have got a potency to differentiate into any one, but once committed into a particular lineage. Teleologically, they are better, particularly when the stem cell is restricted in division, it has got an immense potency. But the more it multiplies, the more it differentiates, it loses this capacity. And normally a stem cell division will be greater than the transit amplifying cells. Epidermis, you find, along with the integrin and the cells have got a lower proliferation. Identification of the stem cells is elusive. There is a story of the Dalmatian, the all-over spotted dog, the only dog which has got spots all over the body. Therefore, since it is elusive in our case, people started searching the stem cells. And in the bone marrow, the cells have got several properties of renewal and multiple differentiating potential. And in 1961, it was Till and Culloch who identified such cells. Colony forming unit, we people know in the spleen, in the bone marrow. Xylem mucin CD34 is important for the stem cell. That is why this is also an important marker in a case of a stem cell leukemia. HSC is equal to KLS, that is C-kit plus lin minus SCA1 plus. The stem cells are also protective against chemicals and xenobiotics. So obviously, they have got a lot of potential not only to multiply but also to save themselves. Think of the Dalmatian again, the all over spotted dog. Forget the class. There is a molecular control. There is a microenvironment, as I had been mentioning, the niche. There can be a combination of cells or the extracellular matrix. These will be governing the cell behavior. There can be a targeted disruption of the TCF gene, and this is a partner of the B-catenin. WNT is another one in which there can be a check on the bone morphogenic proteins. Paradoxically, WNT is activated by ABC gene, which can give rise to the colonic cancer. This will be coming repeatedly in multiple areas. I would like you people to kindly apply them. CNS and the hematopoietic stem cells renewal is regulated by B-mill. Now, this is an important diagram. Forget the text of it always. The diagrams are important. In any of the crypt, you find that there is a crypt over here and then there is a villus above the surface. This may be the surface. Now, what will happen is lower down in the crypt, there will be the different types of cells. Now, this is an absorptive epithelial cell. Then there are the goblet cells over here. Enteroendocrine cells are over here. Transit amplifying cells. All of these cells, TA cells, predominantly are the transit amplifying cells. Then there can be the cyclin cells and the Paneth cells. These can interchangeably proliferate. Now, what happens is this particular region, are you able to see a mitotic figure over here? You find that there will be increased amount of mitosis. It is not the surface that is multiplying that is leading to a neoplasia. It is always the crypt that matters. That is why in the case of Crohn's disease or ulcerative colitis, wherein there is a branching of the crypt and the multiplication of cells, there can be a neoplastic potential. This is a mesenchymal stem cell, and see to what all regions they can. This is the endothelium, then the smooth muscle, the brown adipocyte, and the mature adipocytes. And these are the markers for them. Bulge cells in the niche. Niche, as I told you, is a kind of a microenvironment for the proliferation. Here, I am finding a bulge. This is a hair shaft, and these are the cells. Just like the crypt that I had explained, you find that there will be the epithelial cells, the melanocyte cell, nestin positive, and the mesenchymal cells. There is a region called the bulge where there is an accumulation of the cells. This particular one has got a potency to proliferate and to differentiate in different levels. The erector pili muscle is, of course, used for the erection of the hair follicles. There is always a pluripotentiality of the stem cell. Pluri means many. So, for example, all of this can have the adult stem cells in them. The brain, the muscle, the blood, hematopoietic, intestine, as we had mentioned, skin, heart. So, heart itself, the cardiocyte can be differentiating into the myocyte or vice versa. They are all useful in the treatment of neurodegenerative disorders, in diabetes, and in cancer. Now, is this harvesting justifiable? Time will say. Because there is more chance of a misuse rather than use. And bone marrow and the intestine are being experimented with. Bone marrow can differentiate, and it is already in. The immortal stand hypothesis of Keynes. He is one person. Said there is a propensity of the stem cell compartments to give rise to cancer later in life and can be minimized if the stem cells during the process of self-renewal retain those DNA strands with the fewest of mutations. So if there is going to be no change in those cells, there can be an arrest of the cancer also. The cells themselves can be totipotent, pluripotent, or multipotent. Toti, it has got all kinds. For example, it is a 4-cell stage. Later on, it becomes a morula. It is a totipotential stem cell. There can be a blastocyst, which is a pluripotent cell. Then there can be an adult cell, which is multipotent. So these 3 things I would like you people to kindly remember. All the other things we have already seen. Stem cell diseases. Metaplasia is one, wherein there can be heterotopic changes. Earlier, I was thinking that a squamous epithelium can become a columnar epithelium or a columnar to squamous alone. But then there is a process of de-differentiation. There is something called as mesenchymal metaplasia, which by itself is a university question for you. Again, I have covered it in another class. From one phenotype to another, histologically recognizable. High turnover of cells is there. And transcription factor CDX2 acts on the gastric epithelium in intestinal metaplasia. Their absence can retain the gastric epithelium in the colon. Fibrosis. There can be the development of myofibroblasts, which give rise to pathological fibrosis. Local parenchymal fibroblasts can lead to collagen. Bone marrow cells can lead to hepatic fibrosis, later on cirrhosis. Desmoplasia in the tumors can be there. And also the platform for the anti-cancer agents. Probably they are preventing the spread of the tumors by marked desmoplasia. So this we have already seen. In cancer, there is an initiation promotion theory. Then the painting of the skin can lead to a visceral cancer. Always experimental painting of the animals. They found that they could end up in a renal carcinoma and so on. Do you know that cosmetics can end in renal cancer? That is because of this. Blood, GAT, skin, etc. are all diseases of stem cells. Cancers are all diseases of stem cells. Genetic changes are required, however. So you find in that some cases there can be some genetic mutation which can predispose to the malignancy. The leukemias, as I told you, this can be the marker for it. And the carcinoma of breast, these can be the markers, and this will have to be positive so as to realize it. This is the diagram that I have been telling you people. An important and a simple one which you people can draw. So this is a stem cell. So A is the stem cell over here. It can multiply. Now it becomes 2 stem cells. At one point, I find that there is a stem cell and then there is a progenital cell. There is a blue cell also that comes. So out of a stem cell, I'm getting a stem cell proper and a progenital cell. Look how beautifully the body is able to do it. It is maintaining the capacity to multiply, and at the same time, it is also producing cells that can function. And here also you find the progenitor cell, it keeps multiplying. Then after some time, you find it becomes a differentiated cell. Now, where is the malignant potential? It will be at the region of the stem cell, at the base of the pit, and at the site of the stem cell. You find that the myeloblast or the promyelocyte multiplication will not lead to a leukemia. It is a stem cell proper that is leading to leukemias. So this is a wonderful one. I would like you people to, if possible, you can just say it. It is from Wikipedia. The adult stem cells have got a great degree of plasticity. They can change from one to another. Hematopoietic stem cells can be the base for therapy in hemophilia. And bone marrow stem cells can be mobilized by using the growth factors of the colony stimulating factors. Patients' own stem cells will not be causing immunological reactions. These are all certain things which you people can remember. Can the adult stem cells be engrafted to other locations? Look at this one. Here again, there is a stem cell, probably a mesenchymal stem cell. Yes, it is a mesenchymal stem cell. And look at the range it is differentiating in. And there can be osteogenesis, chondrogenesis, epidermogenesis, myogenesis, adipogenesis. So there is a proliferation, later on a commitment, differentiation, finally a maturation and a function. So that happens in all the lineages and it is possible by means of the mesenchymal stems. Now, can the stem cells differentiate into very many cells in any situation? Not everybody is convinced with their versatility. Moreover, you find that when there is a graph that is taken from these and then it is applied elsewhere, you find that they are sometimes successful, many a time it is a failure. And also you find that they cannot be changing into the terminally differentiated cells, or even vice versa. More the differentiation, less the function. The long-term value of these is questionable. Most people work just hard enough not to get fired and get paid just enough money not to quit. George Carlin. So there's something about the bone marrow cells wherein we'll have to remember the notch. Notch is a region of thickening that can be there. There are the signaling pathways of the adult stem cells. One is the WNT, two is the stem cell regulators, the transformation growth factor beta. I would like you people to just remember these names. All the other things we have already seen. What are the other sources? This is one of the headings I would like you people to remember. Cord blood, for example, Wharton's jelly, then MABs, multipotent adult progenitor cells in mouse, rats, and man, mesenchymal stem cell, dermis, pancreas, liposuction waste, and the normal white cells. So there are multiple other sources for the pluripotent stem cells. This you can mention in your answers. And this is important. You find that. So being a stem cell, I thought this was only some kind of an epithelium, but see its potency. The skin, it can develop into a mesenchymal stem cell, and then it is used for wound repair. It is, in a case of Crohn's disease, do you know? Can you very well remember it or imagine? The graft versus host reaction, spinal cord injury, regeneration of the hematopoietic one, and refractory SLE. It can be used in all these conditions. And this is the reference for this particular one. Potential applications of the skin mesenchymal stem cells. The epithelial mesenchymal transition is one of the ones that I had taken a class on. I would like you to go to it. It is common during embryonic development. Mesenchymal epithelial is a reverse of it. That can be from epithelium to mesenchyme, from mesenchyme to epithelium. And it can occur in fibrotic diseases such as interstitial fibrosis, mediated by transformation growth factor beta. And late in the tumor, it can either promote or restrict metastasis. Now, what is the significance of the stem cells, particularly the adult stem cells and their transitions? One, in the treatment of leukemias or any other bone and hematological malignancies, spinal cord injury, cirrhosis, knee chondral defects, study of the multi-drug resistance, COVID-19. Attempts have been made to reconstruct the entire lung, acute and delayed phases of stroke, Parkinson's disease. I think we have got quite a big list, almost 10 over here. I would like you people to kindly memorize. Now we shall go back to the code. There are no big problems. There are just a lot of little problems. Henry Ford, the inventor of the Ford car. Thank you for your patient listening.